I'm Miss Susan Green, a consultant colorectal surgeon at the University Hospital of North Durham.
My name's Barney Green. I'm one of the vascular surgeons here at James Cook University Hospital.
My name's Chris Wells. I'm a gastroenterologist at North Tees and Hartlepool NHS Trust.
All of our hospitals are still very much open for business.
So many people have thought that during the pandemic, the hospital had closed to all operations and medical care except for coronavirus cases, and that's simply not true.
Our hospitals and all the hospitals in the region are still offering the same amount of service that we normally would do. That would include cancer diagnostics, cancer treatments, cancer operations and all forms of emergency treatment.
So this is the management of heart attacks, strokes, urgent surgeries and things that simply could not wait for the pandemic to pass.
So if you do have any concerns about your health or any new symptoms, it's important that you do report them to your GP as you would do normally. The GP's practices are open and they do link into the hospital where necessary. So it's important not to ignore your symptoms and please do come forward.
The hospital has put a lot of measures in place to reduce the risks of patients who attend the hospital contracting COVID-19. As long as you comply with these measures, the risks will be much less than the benefits of attending for necessary investigations. You will need to wear a mask when you attend the hospital, and you will need to keep this on in all corridors and clinical areas. You will need to socially distance where possible in all areas, but there is plenty of hand sanitizer throughout the hospital.
So a lot of people in the community will be anxious about coming to hospital and worried that they may pick up coronavirus if they come to hospital. It's important that the public are reassured that hospitals are safe and clean.
We would also like to reassure all our patients that we have made our hospitals as safe as possible for both patients and staff, with supplies of personal protective equipment, patient and staff testing, patient self-isolation prior to elective admissions, and protected operating theatres and wards for elective patients.
One worrying thing we've really noticed over the last 3 or 4 months is the significant drop-off in number of people seeking help for urgent conditions such as cancers. I think we can understand why that's the case. People have been desperately worried about contracting coronavirus, and we can understand that. But cancer, heart attack, stroke, these big life-limiting conditions are really, really important to deal with. Don't ignore the symptoms for fear of getting coronavirus. If you have signs and symptoms of cancer, you must seek help, and we will do our utmost best to prioritise you and to get you the care at the right time and in the right place.
Even if you don't feel your condition is an emergency, we do have a lot of urgent and routine services available that we can help diagnose any conditions that people are worried about. And the hospital is open and it's safe to visit.
And the people to talk to, starting off, would be NHS 111. Dial that number, it's quite simple, or go to the 111 webpage to get advice. There's also your general practitioner. I wouldn't just turn up at the front door. I would certainly phone them, talk through your problem in the first instance, and then we can go from there.
The one message that I would like to give to the public is that for the majority, the risks of dying from COVID-19 is far less than the risk of dying from cancer or any other serious illness if the diagnosis is delayed because you ignore your symptoms.
Our hospitals are open, the staff are all here to help you, and it is safe to come and join us.
So please contact either your GP or your practice nurse.
We are here for you. We are open for you. If we call you to come, it's for a reason. We're doing everything that we can to keep you as safe as possible. If you have problems, please talk before you walk, and at all times, try your utmost best to do everything you can to protect yourself, to protect the NHS, to control this virus and to save lives.